Good afternoon. So you're welcome to the session. Um, let's set the rule for this class that we're having right now. First and foremost, I want to say that these are answered past questions. And the questions are coming from the 2018 AUM class. The AUM class for 2018 has been answered. So I think I have 83 of those questions in the scan document that I got. And I now divided them into 8 different sections. So related topics are brought together and I've answered all of them for you. So while we're answering, I would also like to say that for any information you have or whatever you need from me, you can just drop a message. And I would see your message. When I see your message, I would attend to them as they come in. Okay. So I could see a number of us entering the class already. So if you drop your message, I would see them. I'll see them as you drop your message. Okay, so let's proceed. I could see a number of you joining. I've seen a number of you joining the class already. So you can mute yourself. I'm adding you to the stage, but then mute yourself, please. Okay. Okay, so let's proceed now. Like I mentioned to you that this is a kind of revision deck that I've done for you, and it has to do with the questions that you need to answer. And all of us will see the answers together, and I will explain why that answer is actually the answer. I also go further to to give you some kind of memory tip that you would understand that you're actually correct, or to remember. So this particular class has been divided into like 8 topics. Like I mentioned, the 83 questions have been divided into 8 topics: 22 for pharmacokinetics, route of administration and dosage form. Dynamics has 8 questions, antimicrobial and antiparasitic has 11, 14 for cardiovascular and the rest, and it goes on like that until we have the 83. So I'm starting with the pharmacokinetics and the routes now. So the first question here has to do with which route of administration is not parenteral route of administration. And I've answered these questions, but then I would just want to point to the fact that what is important for you is to remember that for every parentera, it means that it has to be by injection. I would like you to look at this memory tip by the bottom. Parentera means by injection. So of course, parentera means that it's bypassing the intestine, or it's not going through the GIT. However, it has to be injected into the system. So these questions can be very dicey, and I'm going to give you another part to it. One other part that can be possible is the fact that someone could ask the question, and instead of pouring rectal here, put sublingual. You remember that the rectal route has to do with, inserting the drug into the rectum of a patient. So it could be a child, it could be an adult, and you remember those suppository that you've used before. So they are rectally administered, right? So it could be rectal as it is, that is non-parenteral. But remember, it also bypasses the GIT into the bloodstream. However, it is not by injection. So somebody that puts a drug under their tongue as well, that also bypasses what's it called? It bypasses the GIT. However, it is just sublingually put under the tongue, and then it goes into the bloodstream. So it's also not by injection. So expect a question. If I was the one setting this question, I would set, rather than putting rectal here, I'll put sublingual here for you. Does that make sense to us? So if I put sublingual here, that is still not a parenteral route. So that would be the answer in that case. So that's what I'm trying to do with this class. The next question is, which of the following route of administration is least likely to give a systemic effect? Least likely. So I want you to just look at the English now. Least likely. That means the likelihood of it having a systemic effect is very low. So any drug that you rub, topical drug that you rub topically, is applied at a particular site, right? So that cannot have systemic effect. Very likely, it's not very likely to have systemic effect. So that's the idea of topical. Topical is most of the time local. Is either you are rubbing it on the skin, or you are dropping it into your ears, or you are dropping it into the eye, as the case may be. So this is what you have. So you should remember that when you are talking about local, it is apply on the surface or apply at a spot where it is needed. So systemic means that it goes into the system maybe through other means. So the next question is, certain factors affect the rate of absorption of drug after administration, except. So if you remember the class you had in the past about factors that would affect how a drug is being absorbed at the end of the day. So an example that you would need to remember very well is the molecular size of the drug. Remember that the smaller drugs, the drugs that have very fine particles, they get absorbed faster, right? So if you have a solid, the solid would have to first of all dissolve first before it get absorbed. So it takes a longer time. So it's not as fast as something that is already powdered. So a powdered drug is better absorbed, and even that powdered drug, if you have the one that has a texture like a powder, like the powder you use on your face, and compare it with the one that has a crystalline texture like what you have in the case of salt. So there are two differences. So the size of that molecule affects how it is being absorbed, and then the pH of that environment. I remember mentioning to us in class about how a particular pH could help absorption of particular kind of drugs, and it's just simple to say that a drug that is higher in a pH compared to the other one has some kind of interaction. So that happens. Then the next one is humidity of the environment. So drugs that is affecting the body, how does the humidity of the environment affect it? So you already see that this is the outlier here. This is the one that is not like every other one. Total surface area of absorption, we mentioned to us before. As a matter of fact, in your ordinary chemistry, one of the factors that affects the rate of reaction is the surface area of the reaction, right? So that is also affecting it here too. The taste of the drug. So it is obvious that taste of the drug would affect how it is being absorbed, because somebody would probably not take the drug at the moment, at that point in time. So that's more like the explanation. So the general tip is genuine absorption factors include all of these things, not external environmental fact, humidity or taste. So if I may say that this question might have double answer, and I want to believe that whatever they said this question, they probably would mark either taste or this. Are we following? Let me see your, just nod if you are following. Let me see that you are following. Okay. Okay, then that's fine. So the next question is metabolism. Now, this is more like trying to define metabolism. You remember ADME, right? Absorption, distribution, metabolism, and excretion, which are the key factors that are required in pharmacokinetics, right? So those parameters are involved in pharmacokinetics, the ADME. They're asking for the metabolism now. Remember that absorption takes place first before a drug is being distributed, and then metabolism will now take place before it is being excreted. So the metabolism is more like saying that the drug is being transformed from one form to another. So it's saying, so which one looks like the definition? If you look here, is a process in non-living thing. Does it happen in non-living thing? No. It is a process, it is not biotransformation. Is it not biotransformation? It is you transforming a drug from one form to another, so it is biotransformation. So that's not correct. The only important process that drugs undergo in the body, is that the only process? No. We still have absorption, we have distribution, we have metabolism, we have excretion. So that cancel that one out too. A process that convert drugs and medicine for development of new drugs? No. So it's not development of new drug. It's even convert whatever it is that you are using to a byproduct. That's what you have. So you have it as a byproduct at the end of the day. So a parameter of pharmacokinetics. Remember, it is one of the parameters, ADME, right? So it is one of the parameters that you need. Now the next question is modify release tablets might be called. So this modified release tablet is most of the time saying that maybe the particular way it is being released, we have extended release. We must have come across drugs that are said to be extended release, right? And maybe you've come across drugs that say slow release, right? So those are modified release tablets. So if you see extended release, obviously that is also a possible one. You could, can you mute yourself, please? Mute yourself, please. Who is that?
You guys
Can you
should be
mute yourself,
serious.
please?
You guys should be serious. The female student, they
Okay,
are
so okay, that's fine. That's fine. That's fine. Anybody that is not serious, I will remove the person from the stage, so you won't have to appear on the stage again. Okay, so you can see that all of these are actually what you can actually call modified release tablets, right? So all of the terms, they relate to it, and this is why now extended release, long acting, prolonged acting are indeed commonly used interchangeably. So they are synonymous to what I have described above, what you have above. So that's the reason. And then the next question again, on still the route of administration, a suppository are dosage form to be administered through, we have mentioned it even in this class. So that's straight away. Suppository that are administered rectally. You all know that, right? So that's the simple language you would need to understand. When you say ophthalmic preparation are to be administered to ophthalmic already, you've heard ophthalmic. So that's the eye, right? No long story about this. Then drugs are eliminated from the body by the following except, so we have drugs that are eliminated by the kidney, and when they are eliminated by the kidney, it goes out through the urine. I want you to know what I'm saying right now, because if I'm the one to set a question, I will not say drugs are eliminated by the following again. I would rather say drugs are eliminated as part of, and I will now mention urine here. I'll put bile here. I'll put your air that you breathe out here, and I'll put physics here. In this place, I will now look for something else to just put for you so that I can confuse you. So what I'm saying in essence is that drugs are eliminated, of course, by the kidney in the urine. Are we following? I want you to note this very well. And then drugs are eliminated by the liver in the bile. Drugs are eliminated in the lungs by the air you breathe out. So as part of your, carbon dioxide that you breathe out, they just come out as well. So the anus in the physics, they are eliminated in the anus in the physics. Physics is your defecation. I want to believe we all get that, right? So that's for that question. And then the next question, which of the following sentences is true? So if I'm going to go through it, drugs with large molecular size are preferred to be administered orally for systemic use. Does it make sense? Drug with large molecular size, yes, they are drugs that have large molecular size, but is that the reason why they are administered orally? No. Drugs with smaller molecular size are better for administration through oral route for systemic effect. Okay. Cod liver is an example of plant source of drugs. Olive oil is an example of animal source of drugs. Excuse me. Then drugs with bitter taste are best for sublingual preparation. All of these things are actually not saying anything tangible here. Cod liver oil is not from plants, right? Cod liver is from fish. Yeah. Olive oil is supposed to be from olive tree. So this one is saying animal. So that's also wrong. Then this is also wrong. So you would see that at the end of the day, what you'll be saying is that all of these are not correct except only this one. And then the next question, pharmacokinetic phase. If you have not forgotten, pharmacokinetic is what the body does to the drug. What the body does to the drug. So the body absorbs the drug, right? Distributes the drug, metabolize it, and excretes the drug. So that's ADME. And that's pharmacokinetic. Remember, pharmacodynamic is what the drug does to the body. So if it makes the body to the temperature of the body to lower in terms of antipyretic drug like paracetamol and the rest, or if it takes away pain as an analgesic, that is, the pharmacodynamic. But this phase, they are asking the way the body and the way the drug is absorbed, distributed, metabolized, and eliminated. That is your correct answer. Remember, what the body does to the drug is pharmacokinetics, and what the drug does to the body is dynamic. Yeah. So parenteral route of administration, this is coming again now, but this time around include the following. Is bringing it in a different way now. As you can see, you now see the sublingual route now put here as a parenteral for you. I want you to be smart about this. Look at it very well. So the sublingual route is coming here again, and then transdermal is coming here again. Don't forget, it has to be by injection for it to be called parenteral route. So sublingual is not injected. Transdermal is what you put in the skin. I remember mentioning to us that we have some what's it called? Some contraceptive that you give every 2 months or every 3 months that is injected into the muscle. So it stays there as a depot preparation and it goes in slowly. That could be a transdermal drug, or it could even be a patch that you are just putting on the skin like this. We have such for analgesic as analgesic drug. So parenteral routes include the following: only intravenous. And I want you to know this: all of the above and none of the above options. So long as you have two opposite answer among the options here, these two will be false. Please note what I just said now. Since I already know that this is not, sublingual is not, sublingual is not, sorry, what did I do? Okay, so sublingual, I've already noted that sublingual is not parenteral, transdermal is not, and I've noted that intravenous is. Then I will not choose any of this. But let's say all of the three of them are not correct. So none of the above will be the answer, right? Which could be the next tweet that they would use against you when you're writing the exam. Somebody can go and bring something else again here. You remember that rectal route. So if the next question that is coming for your own exam says sublingual, transdermal, and then rectal here, then of course your own answer will be none of the above. Please be very attentive. I'm giving you the trick too that they can use against you for the exams. So the transfer of drugs out of a dosage form into the blood circulation is called transfer of drug out of a dosage form into the bloodstream is called absorption. That's the first process. It's coming from where the drug was and is absorbing it into the bloodstream. So that first process that takes it from either the GIT or the site of administration to the bloodstream is absorption. Let's say, for instance, you're taking an IM injection now. In that muscle at that point in time, it is where the drug is being kept, but it's been absorbed from that muscle into the bloodstream. That is absorption, and that's the first thing. So the transfer of the drug out of a dosage form into the blood circulation is called absorption. So if I'm to ask for the other things now, it is from that point of entering into the blood circulation and being distributed to the site of action, it is distribution. If that same drug has to be metabolized, be changed from one form to another, either by the kidney or the liver, which is the site of metabolism of some of these drugs, then it is called metabolism. If it happens that the same drug that has been metabolized is now being excreted either in the kidney or in the liver or in the lungs, then that is excretion. Let's note that. So the next one is which formulation does not have an absorption step. Remember, without even looking at the question, where do we not need absorption to take place?
Intravenous.
Intravenous. Exactly intravenous, like you have seen on the screen. But what it is, I want you to understand this at this point in time. You remember that I mentioned to you that bioavailability is 100% with intravenous administration. So it can only be 100% if you have seen that there's no other means at all for it to be lost. So you are directly pushing it into the blood circulation. If you give IV, you are pushing everything inside the blood circulation. So for instance, you have IV paracetamol being given into the to the blood vessels. That is 100%. So there's no need for absorption. Remember the previous definition of absorption, that is being moved out of the dosage form into the bloodstream. But this one is already in the bloodstream. So it means that there's no need for absorption. You just continue from distribution. Is that correct? So that's for that question. Then the next question, which of these routes of drug administration has the fastest onset of action? Still the same, our intravenous. And the explanation is simple. It doesn't have to be absorbed It has passed the stage of absorption. So if you are giving IM, IM will first of all stay in the muscle, then it will be absorbed from the muscle into the bloodstream. That time alone self is enough to make the intravenous faster. Is that clear now? So the fastest onset of action means the time that you would start seeing the action of that drug. So for IM, it could take maybe 5 minutes, but for IV, it could start like immediately. And you would remember some of the cases that you have seen as a patient, as a pharmacy technician yourself. Maybe somebody comes with, a body temperature of say 41 degrees now, and then you want to decide which of the drug to give or what route of administration will be better. I'm sure you will not make a mistake of giving oral, right? Because oral will take a long time before you can get the results, right? And this time around, the next thing you'll be thinking of is parenteral route by injection. Now, you are giving the injection, you're not going to be giving IM as well. Even though if you give IM, it is still better compared to the oral. But the best route would have been to look for the veins of the person and just, put the paracetamol injection directly there. You get a faster onset. Faster onset this time around will be with time that is required for the temperature to start dropping. So it will be faster with IV and then followed by IM. But of course, oral is the last route. So the next question is I remember I mentioned to you that I grouped the questions by their topics, right? So don't think that's how it came in your question. I was one that regrouped it this way for you. So one of the following is not a pharmaceutical dosage form. Pharmaceutical dosage form. Pharmaceutical dosage form. Remember, so oral is a route of administration, but not a dosage form. I want you to take note of this. Dosage form. Dosage form is that form that your drugs comes. So your drug can come as a tablet, it can come as a paste, it can come as a cream, it can come as a lotion, it can come as a drop. Do you understand? It can come as injectable, but not oral. Oral is route of administration. So if I'm the one to say this question, I could say one of the following is a route of administration and give you still these options. Please note what I've just said now. One of the following, if I want to change this question for you, I'll say one of the following is a route of administration, and I will still give you the same option. And the answer will still be A, the oral. Or I could say all of the following are pharmaceutical dosage form except. Do you understand now? I could say all of the following are pharmaceutical dosage form except, and I will leave it. So the answer will still be except A, which is a route of administration. Do you understand now? And that solves it. So the next question is, which of these is not administered through oral route? Oral route. Huh? So if you look at it, suspension, you can actually have suspension taken by oral route, right? You can have lozenges, your your Dequadin, your Copta, your Strepsils, lozenges like that. You can have your syrups like the vitamin C syrups, paracetamol syrup, and the rest. You can have elixir. Elixir are more of oral preparation as well. But of course, liniments. Liniments are always applied to surface of the skin or a particular part in our body. So it could be, for pains. Most of the time, they are actually taken for pains. So all of those pain medication that comes like a liquid, but you can just apply it at a particular place. Liniment. Remember, this is not exhaustive anyway, so somebody could add more to it for you and say all of the following are, you know, um, administered through oral route, except. So the person is still using your options, but he's not saying all of the following are administered through oral route, except. Once you put except, you are looking for, okay, all of them are correct except this one, and that's all. So the next question says the following dosage forms are prepared for topical use except. topical use except. So the person has brought the idea now. Like this is even the next question coming now. So what you have here is you have, paste, which is actually for topical use. It could be for topical use. Liniment could be for topical use. Emulsion too, we have emulsion that you can apply to a particular surface, and you can have cream too. And then a lizard that has to do with you swallowing is what. So as established in the question, this question 88 and question 90 of this paper. So this, what happened in this paper is the question came twice in different way, especially an oral liquid preparation, not a topical one. So elixir is oral. So the next question, that dosage form for oral routes are sometimes prepared as control release form of preparation. Control release. You cannot have lozenges that is control release. You are licking it, except you remove it from your mouth, right? You say, okay, I'm done with what I'm licking now. Yeah? If you take a suspension, it goes in like that. It cannot be controlled. Yeah? If you have syrup, it can be controlled. If you have cream, it can be controlled. But tablets, you remember, some of you would have come across nifedipine XL before, right? Some of you would have come across nifedipine retard before. Retard. So those are, modified release, like the way we saw it in the other question. Modified release kind of question of tablets. So it's only tablet that can have that means. But if this is not tablet, if this is injection, this option B, if it's injection, do you know that that's also correct? Because I mentioned to you before that you could have a depot preparation by injection, especially when I gave the example of depot provera and the likes of contraceptive that women would use, right? So that's also something to think of. Which parenteral route of administration would typically require the largest needle? This one is just you using your experience now. Which of these will require the largest needle? I'll just tell you this now. So if you are going to a deep muscles, essentially below the subcutaneous layer now, below the subcutaneous layer, naturally you will need a bigger needle so that it doesn't get blocked before it gets to the site of where you want to release it. And that's what causes pain sometimes. So when you give such injection and you are using a very tiny needle, it could cause pain because it gets blocked and it's forcing itself out. By the point of forcing itself out, it could be painful for the patient. So it is intramuscular, intradermal, not necessary, but intramuscular, that is where you need bigger needle. Are we together? So this question now says the best known example of a drug given by sublingual administration is. Have you seen paracetamol kept under the tongue before? No. If you keep vitamin C under your tongue, what will it do for you? Nothing. Amlodipine is also not given sublingually. Salbutamol is not, but you would have heard that there's sublingual nifedipine that is given, right? So if I were the one setting this question, I will remove nifedipine and I'll put nitroglycerin for you. You can write it down. I'll put nitroglycerin for you. You know, people that have angina pain, people that tells you that they have pains in this part of, so they used to have, that's nitroglycerin around. They just keep it under their tongue and then it helps them with that pain that comes in the heart. So it could be called nitroglycerin or glyceride trinitrate. So if I am the one, if I put either of these, that would be the answer. There won't be nifedipine anymore here. I'll just put that and that would just be the answer. Another question here is, any pharmaceutical preparation formulated for instilling in the eye is called ophthalmic preparation. I don't need to stress myself about it. Yeah. Then the next one is the following factors affect drug stability. Yes. So for a drug that is not stable, we are talking about how drug get destroyed. Let me just put it in plain terms for you. So drug that is kept under high temperature can get destroyed faster, right? And that's why you will see on drugs they will write store in a cool, dry place. In fact, that is the word sef. Store in a cool, dry place. Cool meaning the temperature is lower. Dry, less humid. Humidity means there is water. Do you understand? So these two options already cancel out by that phrase alone. Store in a cool, dry place. Poor storage condition. Yeah, poor storage condition could also mean that you are storing it in the sun, you are storing it not in the fridge when it's supposed to be in a fridge and the rest like that. So it means that all of them are actually factors that affect drug stability. Are we together now? So all of them are factors that affect drug stability, and this is just the basic. So we're done with the pharmacokinetics question. Now we're going to the pharmacodynamic questions. Here we have only 8 questions. Yeah. So the 8th question, the first one, say an antagonist. If you say somebody antagonizes you, that means the person is an opponent. He's opposing you. Just use that word. So the only example here is not bind to a receptor. No, that's not the idea. Prevents. It's not just standing alone. It prevents other drug from binding to a receptor. And that's the answer. So it goes to that receptor, it goes there to go and stay there. So that when the owner of the house comes, it has taken over. So just the simplest way of you to understand is when you say an antagonist, the person is an opponent. Pam. And your opponent would always be dragging what you want with you, right? It is what you want that they are dragging with you. So they will go and stay at that receptor site and prevent you from occupying that receptor. That's the simplest explanation. So an example of histamine antagonist. So what I'm going to do here is I'll just take us through them like this first. The only thing that you would have to note here is your first drug there is not an histamine antagonist. It's not histamine antagonist. So you must note that that drug is a proton pump inhibitor. And then the next one is your analgesic drug, and is not related to histamine. But loratadine, of course, it is an histamine antagonist, right? And what it does basically is to just block the histamine receptor, and as a result causes what's it called, itching to disappear. If you have rhinorrhea, like your nose is running, it will also disappear and all of that. So it is a second generation H1 antihistamine. Second generation. So if you ask me what the first generation would be, you already know that pyridine, the chlorpheniramine, would be in the first generation, and this is a second generation. I will move from first to second because this loratadine is a non-drowsy antihistamine. I want you to also pick that, because if I'm the one setting the question, I could just which of these is a non-drowsy antihistamine, and I'll put pyridine there, which is chlorpheniramine there as well. I don't know if you are following me now. So what I'm going to do, if I'm the one setting the question, I could decide to say which of these is a non-sedating antihistamine. We know that pyridine will make somebody to sleep, and pyridine is basically please mute yourself. So the next question says that drugs that have the ability to bind to receptor and cause a response are called so it is giving opposite of that question of antagonist now. The antagonist will go and stay on that receptor, but it will not lead to a response. The essence of a response is we want this to elicit an action. So a drug that is supposed to cause histamine to stop histamine, because we know that histamine causes itching, right? We know that histamine is the one that is responsible for the running nose that we have. So if you block the histamine, so the histamine will not be available to bind on that same receptor. That's in the form of the antagonist. But if histamine gets to that receptor by itself, I will remove you, Sani. Mute yourself.
Sir, it's not me. Sir, it's not me, please.
Okay. That person is disturbing us now. What is this one? All right. Okay, so an agonist is that particular drug that would bind to the receptor and cause a response. So antagonist will not give you any response. So just take it like that. So the next question could be drugs that have the ability to bind to receptor and do not cause a response are called antagonists. I don't know if you are following. This one that bind to receptor and give a response are called agonists. But the ones that will bind to that same receptor and do not give any response are called antagonists. So if I am the one setting the question, I can twist the question that way for you. Okay. So next question. Oh, who is this person now? Okay. So the next question say what receptors are macromolecules that exist as targets for physiological neurotransmitter and hormone? This question I'm not sure, it's not clear. Okay. Receptors are macromolecules. That's this one. Ignore the one there. Receptors are macromolecules that are designed to attack drugs. Is that the point? No.
Oh.
The drug are supposed to bind to it. Yeah. Are resistant to antagonists. No. The receptor are macro that are drugs. No, they are not drugs. So this is the answer. Exist as target for physiological neurotransmitters and hormones. So they are supposed to be like a target where physiological neurotransmitters will bind to and hormones will bind to and give us a response at the end of the day. That's what they are meant to be. And then the next question says the place where a drug causes an effect to occur is called, I want you to remember now, when a drug binds to a receptor site, it gives us a response and we say that drug is an agonist. When something else binds to that same receptor site, it doesn't give us a response. But the response that we are looking for, where does that response take place? Is it the site of administration? No. What is therapeutic window? Therapeutic window is not this. Therapeutic window has to do with, that's the difference between the lethal dose in 50% of the population and effective dose. Minimum toxic effect, no. So the site of action is where it gives an effect. Site of action. Somebody is having pain in the leg and the person has taken paracetamol. So the paracetamol will be absorbed and then it will be distributed to the site of action where it will give reduced pain. So the next thing is receptor affinity. Receptor affinity. So if you look at the Y that I put here, affinity specifically refers to the strength or the tendency of a drug to bind to its target receptor. Two things now, the strength and then the tendency. The strength and the tendency of the drug to bind to that particular site. That is called affinity. So it's a distinctive pharmacological property from whether that binding then produces a response. It's different from efficacy. I want you to just picture this now. So there's affinity. Affinity is this thing has tendency of binding to this. So as a pharmacy technician, you have very strong tendency that you can function where there is no pharmacist. Even though the law says that you should be under the supervision of a pharmacist, you have very strong tendency. That means your affinity to function, it's 100%. But the efficacy is that you are able to function optimally all the time without a pharmacy. I don't know if you understand the differences now. Yeah? So the differences is saying that you can actually function. That is affinity. Yeah? You can do the work. But would you be able to do the work 100% all the time alone? That is efficacy. So how efficacious are you in doing the work? It's different from that you are able to do the work. So the same thing applies to, all of this receptor affinity. So a drug can have affinity to that receptor, but is it able to give the best result? That is efficacy now. And that is why you will now see analgesic. They will say this one is stronger than this one. So they all have affinity to that same receptor, but one is more efficacious than the other. I want you to note that, because if I am the one asking, I would write receptor efficacy is a term. I will now say that it refers to whether that binding produces a response. Simple. So the answer is referring to ability of a drug to bind to a receptor. The drug has ability to bind to that receptor. It has. But to give us the results, how much of result will it give us? This one will give us 10%, and that one will give us 20%, another one will give us 80%. So the drug that gives 80% is more efficacious. Efficacy is 80%. But all of them have same affinity. Does it make sense? Okay. So the next question says the desired action of a medication is called the desired action. Remember that pharmacodynamic is the action that we're expecting from that drug that we have taken. So what the drug does to the body, that's what we are looking at. So now they are not trying to twist it around now. So what is it called? Is it medication reaction? No. Is it safety action? No. Is it curative action? Not necessarily, but it is therapeutic action. Because it might not be curative. Yeah? It can be preventive too. There are drugs that we give to just prevent disease from happening, right? Prophylaxis drug. So it is not only curative. It could be prophylactic or preventive, as the case may be. So the next question is, which of these study the concentration and response caused by drugs? Concentration and response caused by drugs. Concentration and response caused by drug. So it studied the relation between drug concentration and the resulting biological response. Remember that what the drug does to the body is the response, right? So there's nothing else that would study it here except dynamic. This pharmacokinetics, what the drug does to what the body does to the drug. So if this question says it studied concentration and the action of the body to the drug, it will be pharmacokinetic. I don't know if you're following now. Do you understand what I'm trying to push across now? So the memory tip I'm giving you here is relationship between drug concentration and biological response is different from which track the concentration over time. So if this question changed to which of these track the concentration of a drug over time, you remember when we said that at initial point of administration of the drug, it is 100%. If it's distributed, if it's absorbed, if it's distributed, metabolized and excreted, the concentration will be reducing until it fades out of the system. That is pharmacokinetics. But this one we are saying the concentration and the response. I remember mentioning to us where you will talk about how the dose of a drug is being repeated after some time. Hmm? It is repeated after some time because we feel like the dose is not giving us the response, or is not going to give us the response that we want anymore. Let me pause a little bit and give you time to ask questions. Do you have any question before we proceed? Because we are going to the next phase now. Okay, if you don't have any questions, so let's proceed. The next phase is antimicrobial and antiparasitics. This session has 11 questions from the 2018 past questions on AUM. So the first question I got here is, which of the following is an antibacterial agent? Antibacterial. See, it might not be 100%, but when you see something var like this, when you see something acyclovar, something var like this, most of the time it is antiviral. Most of the time it is antiviral. Amlodipine, all of us know that it is not even an antibiotic, right? It is for hypertension. This is a beta blocker. Yeah. Ibuprofen, we all know that it is an analgesic, so it is not an antibacterial agent. Clarithromycin is an antibacterial agent that is used alongside other medication in triple therapy for ulcer, peptic ulcer, right? So it is to take care of Helicobacter pylori and a bacteria, right? So itraconazole, it sounds like fluconazole, right? It sounds like ketoconazole. So it is an antifungal. It is an antifungal agent, right? So this is just the simple explanation about this. But if I'm to say the same question again, I could just come back to say which of these is an antiviral. Still giving you this option. Some of you will say, I've seen this question before, and you rush and choose clarithromycin. So if you do that, you will be on your own. But if I'm the one to say this question, which of the following is an antiviral agent, so that A will become the answer. If I want, I could say which of the following is an antifungal agent, and then E will be your answer. Are you following now? So that could be the twist. So it means that your calmness when you are reading the question is very important, as much as the answer you're trying to choose. So I've finished everything, I'm going to pass it. But in the reason, you're not calm when you're answering those questions. So you choose most of the wrong answers. So the next question, which group of drug is erythromycin? Erythromycin is an antibiotic, right? It belongs to a class called macrolides. Another example in that class. Now, I want to go a twist now so that you can understand how I can twist this question. So I could decide to say the following drug are macrolides, or the following all of the following except one is a macrolide, and I'll put erythromycin in the option and put macrolide up there. So they're asking you for macrolide, that will be it. And if I want to make it tougher for you, I will not put erythromycin, I will put azithromycin instead, which is another example of a macrolide, right? So I could twist it around, or I could decide to put which group of drug is amoxicillin. You remember that penicillin's example of penicillin is amoxicillin, right? If you don't know it now. Amoxicillin is an example of the penicillins, so that could be the case. Now, if I like, I'll put, okay, aminoglycoside. We've done aminoglycoside before too. So aminoglycoside, you can have streptomycin kept there. So if the person keeps streptomycin. Sorry. So if I keep streptomycin, what's happening? Okay, so if I keep streptomycin instead, streptomycin is an aminoglycoside, right? So then this one becomes the answer. Antidepressant with no examples. I'm only trying to refresh our brain so that we can remember that other ones to have uh, a role in this. Antidepressant, you could say you are looking for amitriptyline. So okay, so the next question says the following drugs are medication for treating malaria fever, except this one should not give us any issue, right? Artesunate, sulfadoxine, pyrimethamine, quinine, alofantrin. Does anybody know alofantrin here? Before somebody go and choose alofantrin, do you know alofantrin? So, okay, let me just say it clearly now. Alofantrin kilocure is an anti-malaria as well. Hmm? It was used in the past, but it's been away from the market. I don't know exactly why, but it's not been in the market for a long time now. So alofantrin is also an anti-malaria, but chlorphenicol is not. Do we understand now? So chlorphenicol is an antibiotic. So amoxicillin, and you can imagine that question I was trying to twist. Now somebody he brought it out as one of the questions. Amoxicillin and ampiclox belong to penicillins. Are we following, please? Yeah. Okay. So penicillins, amoxicillin, ampiclox, they are both penicillins, right? Then anti-infective drugs include all of the following except anti-infective. Remember that antibiotics means it means like all the drugs that takes care of any living thing, that can take care of a living thing, anything at all. So it could be parasite, it could be virus, it could be bacteria, it could be fungal, it could be protozoa. Yeah. So now they are now giving you in this way anti-infective. Anything that can cause infection, anything. So any drug that is used against them now. So for here you see antibacterial, that's correct. Antiviral, that's correct. Antiprotozoa, antifungal. But this one, anti-inflammatory drug, no. That's simple answer. The following are drugs that are prepared as ophthalmic medication to be used in bacterial infection of the eye, except. So this fluoxetine, is that your antidepressant that we're talking about? Fluoxetine. The other ones you have seen ciprofloxacin eye drop, you've seen chloramphenicol eye drop, you've seen tetracycline eye drop, you've seen gentamicin eye drop, but no fluoxetine. Fluoxetine is not an antibacterial self. As a matter of fact, it is an antidepressant. So it's used for depression. I don't know if it makes sense to us. So the next one, the following. Yes, go ahead. You want to ask a question? Okay, so the following are example of antifungal, except terbinafine is an example. Griseofulvin is your fusin, is an example. Itraconazole, I just mentioned to us that itraconazole is an antifungal. Ketoconazole is an antifungal. So meaning that all of these are antifungal except nitrofurantoin. Nitrofurantoin is used for UTI. So the person takes it and it goes out of the system through the urine unchanged. So it takes care of any bacteria that it comes across even while it's trying to go out of our system. and it's kind of yellow, so it could make someone's urine to become yellowish as well. Then the next one is albendazole is an example of albendazole. We know albendazole, right? Albendazole is, let me use your own the very local word now, worm expeller, right? So it's an anti-helminthic. Helminths are worms. That's straight. Then the name artemisinin combination therapy medication for treating what disease? Of course, malaria. If this question are this simple, I expect that all of you would pass very well. Hmm? So which of these is an antifungal drug? You can imagine what came out again here now. They try to confuse you. Already you know that Tesunate is not. Yeah, you know that Cipro is not. So these two is cancelled. But the remaining three, they sound alike. Mebendazole is your worm expeller too, like the albendazole. Metronidazole is your flagyl, which is not an antifungal but antiparasitic agent. I don't know if you are following the conversation. And then the last one, itraconazole, is the antifungal that we're interested in. You see the way somebody is just twisting the question for you, making you to wonder about. And then the next one is saying the following antibacterial are anti-tuberculosis medication, except. See, the funny thing in this question is that all of this drug is being taken by somebody that has tuberculosis. All. But he said the following antibacterials. So pyridoxine is your vitamin B6. I don't know if you are following. Your pyridoxine is your vitamin B6, not an antibacterial on its own. But what it does is it takes care of the side effect of isoniazid. Isoniazid causes depletion of vitamin B6. It causes neuropathy. So before it causes neuropathy, you would be using B6 to take care of it. So that peripheral neuropathy that is caused by isoniazid is what you are trying to take care of using this, but it's not an antibacterial. So somebody will say, no, but these are drugs that are taken by people that have TB. Yes, but the question says the following antibacterial are anti-tuberculosis medication, except this. So if I were the one setting this question for you, I would say all of the following drugs are used by patients by I could say that all of the drugs are taken by patients having tuberculosis. I would now put the first three and put this one as third one, and the next one I will now put all of the above. So somebody will just look at the pyridoxine and say, no, but this is what it is. Or I will put three, maybe isoniazid, rifampicin, and pyridoxine, and none of the above. So if I were the one setting the question, I could just put the option A to C, and then I put option C to E, and then I'll put none of the above, and then I'll put all of the above, so that somebody can get confused. Can we proceed? We are going to the fourth segment. Are we together? Okay. So the cardiovascular, respiratory, and GI drugs are the next one now. So antacids are used in the management of ulcer because of their antacid. So he's asking for the mechanism of action of antacid now. What they do is local effect of acid neutralization. They just bend on the acid, neutralize it. That's what antacid does. Simple. They just neutralize the acid. Remember that antacids are base, and then they act on the acid so that they will neutralize it. Simple. So every other thing here is not correct except that. Then, so this is a case study kind of. This is a case study. So if you look at it, AJ is a patient suffering from congested nose and cough for the past 3 days. What type of cup preparation are you going to administer to the patient to relieve the condition? Hmm?
Choose the answer.
Yes, you're already seeing the answer now. But this is, I will just explain why to you so that you can understand why we are choosing that. Yeah. So the person have blocked nose, congested nose, and is coughing. So you need something, an expectorant, to bring out that blocked one. So to expectorate it, that's even an English word. Expectorate means that you're trying to bring that one that is already clogged there, you're bringing it out. And all of these things, none of it will do it except guaifenesin, which is an expectorant. So if you are going to be in a pharmacy and you're checking your shelf to see which of these drugs, you are looking out for one that has, guaifenesin. But I'll give you an alternative to this answer. Some of us would have come across broncholyte. You know broncholyte. Broncholyte has bromhexine inside, and bromhexine is a mucolytic agent. So it breaks down the mucus that is already clogging the person's nose. So if the option here, the option E, is showing you bromhexine containing cough syrup, then that will be the answer. I don't know if you get what I just said now. Let's say you don't have this option E, but what you have in option E is bromhexine containing cough syrup. That is your answer, because it will break down the mucus and then you can have relief. So how many types of antitussives are there? This one is just trying to turn your brain. You know that when you have some cough syrup that are containing codeine and the ones that are not containing codeine. Those are the two things. They are just two: codeine containing and non-codeine containing. You see examples, all of those examples that you say this one is clinical codeine with codeine, and then this one is just pure. I don't want to mention any one of them. So there are just two types: the ones containing codeine and the ones that are not containing codeine. Or we can now term it as such as say narcotic antitussive or non-narcotic antitussive, as the case may be. Can I proceed? Okay, so Ajara has been trying to enter this class for a while now. What's happening?
So it's network.
Okay, so the next question is bronchodilator acts by, first option there say dilation of bronchi smooth muscles, dilation of all smooth muscles. The dilation, then the third one say dilation of spasmic bronchial smooth muscles. So obviously the one that is contracted is the one that we are looking at. The one that is not contracted, then you don't need to dilate it. So that's your answer. This one is just to confuse you. Somebody will just rush to say dilation of bronchial smooth muscles. When you're rushing, you just click that one immediately. So it is trying to test your patient to be able to read through all options. Please note, some questions will show you something that looks like the answer first, and then you will rush to pick it. But it's testing your patient to go through all the options. Yeah? So that's the lesson on that one. The xanthines are examples of bronchodilators. Your xanthines could be your let me remember this example. Okay, yeah. Your aminophylline, your theophylline. Some of you have seen chest and lungs before. That tablet of chest and lungs that you just give people to take, it contains theophylline inside, right? So those are examples of xanthines. So they partly they work partly via phosphodiesterase inhibition to relax bronchial smooth muscles. So another one is antacids are used in management of ulcer because of their, I'm sure that we have seen this. I've sent this document to you but I'm just trying to go through it with you as well so that it can help you better. So if you have read them and if you are going to read them, I'm sure you'll pass this exam. Bottom line. If you have read them or you still want to read them, you are passing this exam, because I've been able to attend 2018 and 2022 for you, for the two AUM and BDT. Sorry. So the next one is antacids that are used in the management of ulcer because of their local neutralization. So this question is coming again now. I don't need to go through it. So what are the agents that reduce gastric motility called? Gastric motility. A lot of you use Buscopan a lot, iocin tablet. Somebody is saying they have stomach pain. So you're already giving them what's it called? Buscopan already. So this is what they do basically. They just reduces gastric
Motility.
motility. And there are some other ones that you have also used. You know, the loperamide. Somebody's having diarrhea, and then you decided to give them loperamide. That will just, stop the whole thing from moving. So these are examples now. Then the next one is, which of the following is not used in asthma treatment? Which of the following is not used in asthma treatment? I'm sure you know that they give aminophylline injection, right? And then theophylline tablets, you
Yes.
can see it given too. So this Safrilucas, even if you don't know it, some of you would have come across
Yes.
Montelukas before. Hmm? Would have come across Montelukas before
Yes.
being used. And then the next one is prednisolone. Prednisolone is a steroid, so it's also used to lower the reaction of the body to whatever is sensitizing the bronchioles. But ibuprofen is not used, so your answer is just straight. However, like I mentioned, go through the option so that you will not rush and pick ibuprofen and then you now see something below. So the next one is a case study. It's saying HH is a patient on admission with an asthmatic attack. HH is a patient on admission with an asthmatic attack. What drug do you think would provide immediate relief the patient needs? Immediate relief. So they are asking for drugs that you can take like immediately. Or maybe you're just passing by. As you people are even trying to write the exam now. Maybe you're struggling to enter and somebody start choking. The person start wheezing. You're hearing that sound, that wheezing sound. What will relieve that person? Let's say that person is HH. What will relieve that person at that point in time is what they're asking you. And your answer is not far. You will not give tablets salbutamol because it will not give immediate relief. But of course, you can give the inhaler salbutamol and that will do that magic for you, like immediately. Don't forget what they did. The immediate is the key thing in this question. Yeah. And then the next question says the medication used to prevent nausea and vomiting are called drugs that stop vomiting. They are called antiemetic. Antiemetic. So if somebody want to ask the question opposite way now, they said um, vomiting and nausea and vomiting is called what? What's the biological term of nausea and vomiting? I could change the question. That is emesis. Emesis. All right? Emesis. So this person is saying antiemetic. So the drugs are antiemetics. So another form of question that I could ask around this is I would say the following are not antiemetic except, so I will list all kind of drug and I will now put your promethazine there, which is an antiemetic, which stop vomiting, right?
I'm not hearing you.
Is it the only one not hearing me?
So I'm not hearing anything.
Who else is not hearing me? who else is not hearing me? Is everybody hearing me? Hello? If you are hearing me, unmute yourself. Let me hear.
Hi.
Okay, who just spoke now? Somebody is hearing me, right?
Yes.
Okay, so Muchaba, I think you should check your own then. Check your end. Okay, so I'm just going to continue now.
Okay. Mungkin agak
Um so you can imagine what came next now. The next question is saying, beside metoclopramide, which of these is an antiemetic? You can see the next question now. So the question that I was saying I was going to twist, the person asked the same question. So instead of putting promethazine only now, it has put beside metoclopramide. So it's telling you that if I'm going to twist this question, I could say the following are antiemetic drug, and I'll put metoclopramide as option A. I'll put promethazine as option B, and then I'll put C and D. Maybe there's no E. I'll put C and D, and I'll put none of the above, all of the above. So all of the above will become the answer because the two of them are antiemetic drug. Are we clear now? So the next question says, in the treatment of constipation, laxatives are used. Which of these medicine is a laxative? It's very odd. Bisacodyl is a very odd one there. Bisacodyl is a very odd one there. What brand name is common with Bisacodyl? Ducolax.
Yes.
Some of us will have come across Ducolax before. So Ducolax, of course. So that's the odd one there. That's the one. Amoxicillin is an antihypertensive. It's an antibiotic. Tetracycline is an antibiotic. Doxycycline is an antibiotic. Then antacids are, what they are, but not laxative. Dash drug is used in treatment of diarrhea. So I mentioned this before. You are now seeing it again now. Bisacodyl will rather cause diarrhea because it is used in constipation, but it will not be used to treat diarrhea. So loperamide is what can be used. And then drugs used for treatment of non-infectious diarrhea are called anti-diarrhea, non-infectious. So you already know that this is not because of a bacteria. You just use anti-diarrhea. Simple. So we are going to the next phase, which is the CNS pain and psychiatric drug. Are we together? Okay. So the next one has to do with medication used to manage conditions like mania and schizophrenia are called antipsychotic drug. Mania and schizophrenia, antipsychotic drug. Example of such a drug could be haloperidol or chlorpromazine. I know that this is not an area that you might have covered that much, but just for sake of letting you know, haloperidol is one drug that is used very well in psychotic patients. Chlorpromazine is also another drug that is used in psychotic patients. So and they're also used in mania too, as well as bipolar disorder. So mania, bipolar disorder, they are also used in them too. Bipolar means that somebody has two um, bipolar, two opposite end of a condition. You see that same patient being very, very talking too much, or being very active, and the same patient after a while will become very moody again. So the person has depression, at the same time has schizophrenia. That's more like bipolar. So the person has that high spirits, jumping around, blowing everything, being very active, and then this next time you see the person is crying because they are depressed or something. So that's bipolar. So the next one say a patient with a swollen joint after an accident came to the pharmacy where you work. Which of this medication would you give the patient for the condition? Swollen joint, that's an inflammation. Don't forget, that is an inflammation. So you don't just need a drug that is an analgesic, but you also need a drug that has anti-inflammatory action. And that's why you now choose diclofenac instead of paracetamol or even morphine. Morphine is a very strong an analgesic. However, it doesn't have anti-inflammatory drug action. Anti-inflammation, that swelling to reduce, you will need a diclofenac. Are we together? And of course, diuretic is one of the drugs that are used in hypertension, in high blood pressure, right? So it's not used here. It doesn't have any place here. So the tips I gave you is that swollen joint needs both analgesic. You said what? Did I hear I should come again? Okay, so someone has to unmute themselves there too. I don't like it when you can't follow simple instruction like this. Okay, so the next one says the action of NSAIDs involves the following except. NSAIDs involve the following except. So the except is saying that one is not the action. So NSAIDs inhibition of cyclooxygenase 1 enzyme, inhibition of cyclooxygenase 2 enzyme, inhibition of peripheral pain pathway, then all of the above. Then the last one said inhibition of both pain pathway of the CNS and the peripheral nervous system. So NSAID can do all of the other ones, but not this one. You can imagine you cannot say all of the above because this one is also not covered. Muchitaba, can you hear me now?
Yes, sir.
Okay, good. So the next question says they act by stimulating gamma aminobutyric acid receptor in the ascending reticular activating system of the brain. What group of drugs are they? You see, you don't need to just bother yourself. You see, whenever you see this gamma is an inhibitory neurotransmitter. Unlike the serotonin that are excitatory neurotransmitters. So gamma slows you down. It makes you cool. But serotonin makes you active. So you're already seeing that. And if it happens in the brain, if you're going to slow down, you're going to sleep. So they're saying that these drugs are likely to cause sedation. They're likely to make you sleep. So you don't need to even go further. Barbiturates are example of such drugs. And that is simple. They are very simple like that. And this is their own mechanism of action. So the next one saying medication used for the relief of pain are called, of course, analgesic. I will not stay long on this. Then phenobarbital is one example of barbiturate. The same barbiturate that they told us that has some gamma there, gamma butyric acid, is what they are giving us example of it now. So the question can be twisted and said, barbiturate, which of the following is an example of barbiturate, and they put phenobarbital in the option. I want you to look out for questions like this. That's the way they are always changing questions. They will not, if they want to repeat, they will repeat just few directly, but they can twist questions just to see who is actually attentive, who is actually looking at the questions, and who understands this thing very well. So we're going to the sixth segment, which has to do with adverse reaction, immunology, and genetics. We have 6 questions here. So the question here says, which of these is a result of immunological response? Immunological response. I'm sure when you remember when we talk about side effect and adverse drug reaction, we try to classify them differently to say side effects are mostly extended pharmacological action. Extended pharmacology. So we expect them, we can predict them, that this is a likely side effect. For instance, somebody had taken loratadine, that causes dryness, that causes dryness, that rhinorrhea, that's running nose will dry. But because it causes dryness of such secretion, it goes as far as the salivary gland to also causes dry mouth. That is a side effect, right? And it's expected. We can predict it that it's going to happen. But hypersensitivity or adverse drug reaction, it is not predictable. It is a response to something in the system. So immunological reaction is hypersensitivity, not a side effect. Not depression, because it has nothing to do with therapeutic failure. It doesn't even make sense. So that's the basic answer. Are we together now? So if I'm the one asking this question, I can say which of the following is not related to what's it called? Is an extension of pharmacological action of a drug, and I'll put side effects and these options there. And at the end of the day, side effect will become the answer, because that's the extended pharmacological action of a drug. So the next question says, which of these is true of contraindication to a drug? So when they say a drug is contraindicated, let's just look at it this way. We are saying that for a particular condition, if you take this drug, maybe it will worsen the condition. That's one. Say, for this situation of the patient, maybe the patient is pregnant or the patient is young, then this drug can cause problem to the patient. Then that's it. Or characteristics of the patient. Oh, the patient has liver problem. So if you give them this drug, it is also going to cause problem. You have defined it that way. And as a result, contraindication is any condition or reason a drug should not be used. I'll give you an example now. We'll say that ciprofloxacin, who is that now? Anyway, you say contraindication is, and ciprofloxacin is contraindicated in patients that are below 16 years of age. That's a contraindication. So it means with that particular specific kind of patient, you cannot use it because it is dangerous. And that's it. Then I'll go to the next one. Which of these is as a result of genetic factors? Photosensitivity, meaning that you are sensitive to light. It might not be. It might not be because of genetics. It might just be a particular thing that you are going through at that point in time. Hypersensitivity is likely, but idiosyncrasy is more because everybody is behaving one way, but you are behaving differently. That's idiosyncrasy. All of us take paracetamol, and when we take paracetamol, it doesn't cause GIT irritation. But when you take paracetamol, you will feel that as if you have taken diclofenac. That's the idiosyncrasy. We're not expecting it with that, so that's more like it. Then the next question says, which of these is as a result of immunological response? Somebody is somewhere that is distracting us. Can that person just mute themselves? Muchaba, can you mute yourself? Let me see whether you're the one. Dorothy, can you mute yourself?
When he comes into mode, he will also do his part. You understand? Madam? Yeah, okay. Normally,
so which of these as a result of immunological response? That question is coming back again, hypersensitivity. So side effect is, you can imagine, an extension of the pharmacological effect of a drug. Something I just defined earlier for you. So then the next one says addiction. Addiction is characterized by the following. So before you can say somebody is addicted to something, the person must be dependent on that drug. The person must be dependent on that drug. The person wants the drug every time before they can be all right. That's one. When they withdraw the drug, there's a reaction for that person. The person craves for the drug again. The person that is also addicted at a low dose, as a decreased dose, they feel like this drug is not enough for them, so they want a higher dose. That's already an addiction, but compliance has nothing to do with addiction. So that is the except there. So I go to the next stage, which has to do with the name of the drug. Generic name of a drug is also known as the non-proprietary name. And then the next one is, one of these is not a natural source of drug. Natural source. Plant is natural, animal is natural, mineral is natural, herbal is natural. Of course, when you say synthetic, we're already saying we want to prepare it chemically. That's what it means. So it's not natural anymore. A drug is given 3 names, which are chemical, trade name, and generic name. So that's it too. And this time it's pharmacology that we're even talking about, that the study of substances and their effect in living things. That's pharmacology. Trade name of a drug is the same as the brand name. So if you have Augmentin, for example, that is the brand name and that's the trade name. But that same Augmentin by another company is amoxiclav. That same Augmentin by another company is Fleming, and it goes on and on. So that's the trade name and that's the brand name. All of them have the same non-proprietary name, which is amoxicillin clavulanic acid. So, okay, of course, the proprietary name of a drug is the same as the brand name. Remember, it's now coming this way now. Brand name is the same thing as trade name, and then the proprietary name is the same thing as brand name. So drugs comes from all of the above, of course, from animal, from plants, from human. That's where they came from. Insulin is an example of medicine from animal. So this insulin, you remember, it was from bovine pancreatic tissue that we got insulin from, according to history. So that's from an animal source. Cocaine is an example of drug from plants. So from coca leaf, Erythroxylum coca is the same is the plant that gave us cocaine in the first place. So that's the plant. And I'll just go to the last session now, and this has to do with the endocrine, reproductive, special classes, and the rest. So this number 1 here, contraceptives are drugs. or devices used for, you know them already, that's birth control. So here they said drugs and devices. So don't forget, we could have devices like the intrauterine devices that you use for the barrier method, where you only prevent the semen from getting to where it is going to fertilize, you know, the egg. So that could be a device, it could be a drug, depending on which is being used. The next one is vitamin K is needed in the body for platelet formation. Platelet formation. As a matter of fact, it plays a role in the synthesis of some clotting factors, factor 2, 7, 9, and 10 in the liver, enabling normal blood coagulation to take place. So not necessarily that we can say, we might not necessarily say that it has role in platelet formation, but it has role in coagulation. There's an option that looks tricky here, anticoagulation property. So it's not directly anticoagulation, it is coagulation. So if this option was coagulation property and there's no platelet formation, that might be the best answer. And then vaccines are used for prevention of infection, not treatment, not to cure any disease. So they prevent disease, they prevent infection. So which of this is true? Vaccines are chemical substances used for prevention of infectious disease. Vaccines are medicine used for prevention of infectious disease. So this is the difference now. The first one say chemical substances, the first one say medicine. So not just chemical substances, but medicine that's gone through clinical trials for it to be called a medicine. And then the next question is saying the following are medication used in the management of diabetes mellitus, except glucose tablet is not used in managing diabetes. So that one knocks it out completely. Remember, metformin is a biguanide. Glibenclamide is it's a sulfonylurea, and the rest as we have them. So anti-cancer are drugs used for management of what condition? For cancer, obviously. Antinucleasics is another name for anti-cancer, obviously. And I will say that come to the end of this class. Some of you have distracted the class a lot, but at this point I'll just ask if you have any questions. If you do have, let's speak on, otherwise we can call it a day and fix another class subsequently. Do you have any questions?